Cerebral Palsy by Cynthia Cummings. Cerebral palsy is a group of neurological disorders that appear in infancy or early childhood and permanently affect the part of the brain that controls muscle movements. Cerebral meaning the area of the brain that is affected, and palsy meaning the lack of muscle control. Formerly known as Little's disease, from Dr. John Little, he was the first person to study spastic cerebral palsy, and he believed that it was caused by birth injuries during labor. It was later coined cerebral palsy by Dr. Sir William Osler in 1887. Dr. Sigmund Freud later stated that cerebral palsy might be caused by abnormal development before birth. Cerebral palsy is caused by malformation or damage to the brain, abnormal brain development, usually during pregnancy, but can occasionally be caused during delivery or after birth. Premature birth is associated with an increased risk of cerebral palsy. It is the most common motor disability in childhood. It is estimated that 1.5 to 4 per 1,000 births are affected, and 1 in 323 children are identified to have cerebral palsy by the Centers for Disease Control. It is estimated that somewhere between 500,000 and 700,000 Americans have some degree of cerebral palsy. Risk factors during the prenatal period include infections, chickenpox, rubella, cytomegalovirus, bacterial infections in the placenta, maternal pelvic infections, multiple gestation, and pregnancy complications. The perinatal period would be prematurity and low birth weight, prolonged rupture of membranes, abnormal presentation, preeclampsia, asphyxia, long labor, and complicated delivery. During the postnatal period, brain injury can be due to head trauma, meningitis or encephalitis, toxins, infections, or stroke. The different types of cerebral palsy include spasticity, which is stiff muscles, dyskinetic, uncontrollable movements, or ataxia, poor balance and coordination. It just all depends on what area of the brain has been affected. The most common type of cerebral palsy, affecting 80% of the people that have been affected by this, is spastic cerebral palsy. There are 3 different types of spastic hemiplegia, affecting one side of the body, spastic diplegia, either affecting both arms or both legs, and spastic quadriplegia, which affects all 4 limbs, trunk, and the face, and often have other developmental disabilities with this as well. Dyskinetic cerebral palsy affects 20% of people with CP, and it affects muscle tone that changes from too tight to too loose and has uncontrolled movements. It affects hands, arms, feet, and legs. Sometimes the face and tongue will be involved with grimacing and drooling, making it often difficult to swallow and talk. The least common cerebral palsy is ataxic. It can affect 5 to 10% of people that have CP, and it comes with problems of balance and coordination. They are seen with an unsteady walk and a wide gait. They have difficulty walking in a straight line. They have difficulty with fine motor skills such as writing, and they have difficulty controlling their hands and arms when reaching for something. The fourth type of cerebral palsy is mixed. It is a mixture of spastic and dyskinetic, having involuntary movements. They have exaggerated jerky movements, abnormal reflexes, poor posture, tremors and shakiness, and issues with coordination. And it is important to remember that with any of the cerebral palsies, they have associated problems with intellectual disability. It's estimated that half of the children with CP have problems with functioning or thinking, and some have average abilities with some learning disorders, and others have perfect normal intelligence. There's also seizures associated with any of these and vision difficulties because the injury to the brain often affects eye muscle coordination. More than 3 out of 4 children with CP have strabismus, and they also have limb shortening and scoliosis. They have dental problems because of poor oral hygiene, and some of the medications that they have to take for seizures may contribute to cavity formation. They also have problems with hearing loss and joint problems, difficult to prevent contractures in some of the extreme stiffening of the joints caused by the unequal pull of one muscle over the other. They also have problems with spatial awareness, affecting one side of the body. They cannot sense the position of their arm, leg, or hand on the affected side. An example of that would be when a child's hands are relaxed, he cannot tell whether the fingers are pointed up or down without looking at them. The pathophysiology of cerebral palsy is an impairment in the area of the brain that controls movement and muscle tone. These can be due to congenital or acquired malformations or damage to the brain during pregnancy, delivery, or after birth. Congenital CP is mostly caused by maternal infections that lead to increased cytokines that circulate in the brain and blood of the fetus, causing inflammation that leads to brain damage. Acquired CP is meningitis or encephalitis during infancy, causing inflammation and damage to the brain. Head injuries caused by motor vehicle accidents or child abuse, shaken baby syndrome. The list goes on here. And cerebrovascular accidents can be caused by stroke or bleeding in the brain or blood vessels that do not form properly, a heart defect, or sickle cell anemia. Cerebral palsy is not curable. It's chronic. It's not progressive. It's permanent, and it's unique to the individual. Signs and symptoms of a baby under 6 months of age is the head will lag when picked up while lying on the back, as you can see in the picture, or they will feel stiff or floppy. They will have overextended back and neck, like they're pushing away from you, and their legs will get stiff, and they cross like scissors when picked up. The signs and symptoms of babies over 6 months and over 10 months are listed. Asymmetrical tonic reflex, reaches out with only one hand, keeping the other fisted. Over 10 months of age, it crawls lopsided, pushing off with one hand and leg while dragging the other hand and leg, or they'll scoot around on buttocks or hop on knees, but will not crawl on all fours. This can be very subjective and difficult to diagnose on these signs alone. It is important to talk to your pediatrician at routine visits because children rates of development vary, and it is difficult to make a definite diagnosis of mild cerebral palsy in the first year or two of life. There isn't one particular test to make a definite diagnosis of CP, but there is developmental monitoring, tracking your child's growth and development over time, screening by asking parents a series of questions pertaining to the developmental motor movement, and medical and developmental evaluation of motor skills, muscle tone, reflexes, and posture, and taking a medical history. There's CT and MRIs to get images of the head to determine whether there's any abnormalities in the brain. And the electroencephalogram, genetic testing, and other metabolic tests are used to confirm a diagnosis. Since CP is not curable, the treatment options are to help with the symptoms. Occupational therapy helps with the function of everyday tasks. Physical therapy helps to strengthen and works with flexibility, mobility, and function. Speech and language therapy helps with jaw exercises, breathing, language and word association, and articulation. Braces and splints are used to help improve mobility by stretching muscles that are overflexed or contracted. Drug therapy is used to control symptoms associated with CP, including seizures. They have drug therapy for the muscle contractions and for pain. Surgery is used to decrease spasticity and lengthen tendons to decrease the impact of contractures. The end.